Okay, we're just a few minutes behind here, but we're gonna see if we can make some time here on our last presentation here. A lot of the things that that I'm going to talk about here reflect some of the things that Aaron said already about using exercise as a prescription pill. But I'm going to focus more on cardiac rehabilitation, so patients with cardiovascular disease and the benefits of cardiac rehab. So we're going to discuss briefly the current guideline indications for cardiac rehabilitation CMS coverage. We're going to review some of the outcome data, safety, and cost benefit of cardiac rehab. And we're going to identify what are the most common barriers that prevent patients to get to this important intervention, and learn some of the innovative ways of delivering cardiac rehab around the world that is not done here in the US, but maybe in the future. So Aaron said at the beginning, the first talk, about the dose response of exercise, and Hippocrates already knew that or thought about that. He talked about the importance of having things balanced, not too much, not too little. He knew the importance of exercise. He knew the importance of balance, too much eating or not. So this is not news. It's just common sense and observation. This is a study that shows some of that dose response on the amount of daily physical activity in minutes and the benefit in mortality. And you can see that there's a dose response here, but I want you to focus on where the benefit starts, 10 minutes. So like Aaron said at the beginning, none is unacceptable. It's because with 10 minutes of exercise a day, you can already see a difference in all-cause mortality. So just illustrating the importance of getting out of the couch. If you look at the exercise capacity and mortality, that's also important. The more fit you are in terms of metabolic equivalence here in this study, the lower your risk for mortality. So there's about a 10 to 25% reduction every time you get 1 mat of increment in your physical capacity. About a 7.9% reduction for every minute increase in your treadmill, in your peak treadmill. So altogether, the risk for all-cause and cardiovascular mortality associated with fitness is similar to cigarette smoking or elevated cholesterol levels. So although not identified as an official risk factor in your calculators for risk stratification, physical inactivity, make no mistake, is a significant risk factor for cardiovascular disease. So we can look at exercise and cardiac rehab here as an exercise pill. Here's just a list of all the benefits